Again, thank you to Zomedica for having us. I want to say a couple of things. I love the advancement of veterinary medicine. I love where it's going. The future is bright, my friends. I have been in this position at DVM 360 where I sat on many client calls. I curate the content for continuing education for you and your colleagues here in the United States and around the world for webinars. And I can tell you, it's a great time to be a veterinary professional. There's so many great things, and Zomedica has an incredible portfolio, and we're going to talk about two of them that's in their arsenal for management. So there is often a disconnect between pain perception from the veterinarian and pet parent. Comment in the chat box, why do you think that is, everyone? So let's see what we got coming in. Yeah, agree that there's a disconnect. My chat says disable for some reason. Yeah, agree. Chat box not working. Okay, just put it in like the answer Q&A or whatever, because I think that some pet parents believe that age is just a disease, is really what it is, and so and for some reason we have these conversations, and they're like, when I do the virtual, hopefully you're doing some virtual components too, but when I'm chatting with them on the phone, they're like, oh yeah, that's okay. And you're looking in the background and they're doing the whole head bob thing. And you're like, that's not okay. There's some things that are going on. So oftentimes pain can be perceived as a behavioral issue. In other words, sometimes there could be having difficulties doing number one or number two in the litter box. And, that can certainly be inappropriate elimination. But in fact, maybe the litter box height is too high, like the lip is too tall for those cats. Or if you look in the back, like when I do the virtual visit, say, show me the backyard, when you take them into the backyard and you see that there's, stairs instead of ramps. Those are some difficulty things. But then pacing, decreased playtime, limping, inappetence, restlessness, they can often be perceived as a behavioral issue when in fact they're actually having some pain. So that's one thing to always keep on your radar, realizing that, that might be something that might be going on as well. And then, you hear this often too, like when I'm doing my history, like Dr. Christman, she's still eating and drinking fine. I'm so glad she's just comfortable and not in any pain. She's just getting old. Like, what do you mean? What is that? What are you supposed to talk about? Because age is not a disease. Hopefully you agree with me. Like in 2023, now I'm saying 2023 because we're here, almost there. We should be able to make sure that our animals are free from pain, anxiety, fear, and stress. And there's so many great modalities that are out there. And the most expensive tool and the strongest commodity that's out there is you. You're investing your time this evening to learn more. You go into continuing education. You went to vet school or to vet tech school, and it's a lot of schooling to give that expertise. So that physical exam is super, super powerful. And what are some things that we can do? I love to do these things too with our team. When we were at curbside, some of you may still be or whatnot, but you can really observe a lot of things from coming out of the car. Looking at their gait analysis, I would say to the techs and the receptionists and say, do you think it's a front leg or back leg lameness? Because sometimes they'll just come in like limping as a presenting complaint. And so we'll take a guess. And so looking at gait analysis, are they orthopedic? Or are they neurologic? Or is it osteoarthritis? Is there some sort of trauma that's going on? Proprioceptive deficits. We know how important that is to look at conscious proprioception as well as superficial and deep pain for neurologic purposes. But sometimes there could be some of that nail wear that you see. And how many of you are looking at the nails themselves when they're coming in for their physical exams? And this may not even be, it could be something that could be from a soft tissue injury in the young animals, but I'll often see this in my older dog patients too, especially me seeing a lot of dachshunds. I do see some of that nail wear that's happening. And then sometimes slow walk from curbside coming in to see you, and difficulty squatting for number one and number two. Sometimes you'll see them like, okay, hold on, give me a second. I could take a second to squat. I mean, you do realize there's quite a few muscles that have to be engaged in order for them to have a bowel movement or to do a urine, to even do a lateral leg raise for the boy dogs to urinate. So those are some things that can cause some issues. So I'm going to show you some things that we can help kind of close that gap, if you will. And hopefully the chat can work. If you can kind of say yes or no, this really helps me in understanding. Have you heard of something called Pain Trace? Has anybody heard of this before? This is a newer technology. I do invite you to a webinar that we're having Monday night at DVM 360 to really get into the weeds further on Pain Trace. We're going to be doing a webinar with them on it. But the reason why I'm a big advocate for this is because that disconnect that happens. My dog isn't in any pain, Dr. Christman. She doesn't need that dental. She's doing fine. Well, let's see if we can monitor and look at what pain is. So this is a wearable monitor that's measuring both acute and chronic pain. I think this is really brilliant. I will say something that Zomedica has to be on the lookout for. They have some sort of a remote monitoring system that'll be available for your patients to measure temperature, pulse, heart rate. These are very, very hot. I'm going to say this one more time. Very, very hot in veterinary medicine right now. I sit on a lot of content calls and so forth, and it's very. I think it's incredible. I think the data is there. It's nice and strong. So be on the lookout for this. Pain Trace is one of them that measures both acute and chronic pain. So it's a real-time pain levels. So these skin mounts. So picture it as almost like an EKG machine, but it's not. So those monitors that you have to put, the attachments that go on, the leads. So they're just going the left and the right side that you'll see in a moment. And they can wear them for X amount of minutes while you're doing your physical exam. So you're palpating along the way. You're looking at the oral cavity. Maybe you're thinking there might be some sort of like spondylitis, or if you're looking at x-rays and you see, spondylosis deformans around the lumbosacral area, maybe you're palpating along how that hurts. So, lameness, all those different things that you can think of, you do that physical exam. And so it takes about 5 minutes to prepare it, and you can even train your technicians to do it. And what you're looking at here is your X and Y axis. So the company would provide you with a tablet, and it'll show you real-time data on this that will go into your practice management software system eventually. But it will, on the X axis is what you're looking for the duration. So maybe you're doing it over the course of 10 minutes, 15 minutes. And on the Y axis is your deflections. So the redder or the more deeper it is, the more pain there's present, versus the blue, there's less. So let's just say a great example that I did is like I slowly pushed a chair on my foot while I had these monitors because I use this on the human side too. And so, obviously it hurts, but I want to see how sensitive. Well, sure enough, it really definitely did its job. When it knew I was in pain, there was a sharp spike on that Y-axis that you see in front of you as an example. So it gives you an idea of like both the acute and chronic pain, depending on how long you want to have that monitor on there. And this is an example of a dog that was a Greyhound. I feel like Greyhounds are so notorious for masking their signs. They're so stoic. There's certain dog breeds that are just so stoic, and then others, like you happen to just do a very light nail trim and they scream bloody murder, Chihuahua. But anyway, so this is a 6-year-old 33 kg Greyhound that had inflammation of the digit left forelimb. So what happened was there was a non-union fracture that the x-rays confirmed, and Pain Trace was used to utilize it because the dog wasn't showing any evidence so much of pain upon weight bearing on the affected foot. So as you'll see in a moment, they did a toe amputation, sent him home on some pain medications, and they followed up with Pain Trace so you could see like the before and after. So it's just like kind of like a short story to share with you. And so if, again, on the x-axis it looks like from 10 to 20, so it's about 10 minutes that you're looking at in terms of span, and the y-axis is the deflections. So remember, our animals, just like us, we compensate our pain. So if we know we're going to be lame in this particular instance, the left thoracic limb, we're probably going to be compensating a little bit more with our left shoulder or scapular region, and even our right side too, because you do the whole head bump, so everything hurts. So if you go along physical exam, you're touching, you're palpating, this is where you're seeing some of those deflections. And sure enough, on that left forefoot, that's where you see some of that significant spike that's there. So think about like I did this on a dog that had serious periodontal disease and grade 4, but mom could have sworn, oh no, she doesn't need it, she doesn't need it. But I go to touch the gums, and sometimes you get that chatter, that but this dog, I went to just like press. I mean, it hurt, and she thought that was just a reaction. And I showed her, I was like, listen, we got to get these teeth extracted and do a full cleaning on the ones that are going to be viable. And she consented to it. So, think about those kinds of clients. Is this for everybody? Not necessarily, but this is something like what I'm showing you tonight are things to keep on your radar as we move and advance and progress in veterinary medicine. So this same Greyhound, 5 days post-op exam over the course of about 8 minutes. You can see this exam was done with her laying down on her side. So they were palpating the incision a little bit, looking at the left shoulder. She stood up, a little bit of weight bearing. but not as bad. They removed the sensors. And so this goes to show you that, yeah, she was not as painful after the amputation. And this also begs the question, like, am I using the right pain protocols in my patients, right? Because remember, not every dog and every cat's a little different on how they go about with pain. So, so that's something just to be mindful of. So what are some other indications? So think of your pre and post-op surgeries, like the one we just showed. Think about chronic pain. Think about those osteosarcs, palliative care. Is it time, doc, to put my dog down? Is it time to put my cat down? And maybe you put the pain trace on your house call visits to show them, you know, in real time. Maybe you and I know that it's time, but maybe they need to physically see that quantifiable data to kind of make them make the right decision that's in the best interest of the animal. So that's something to think about. They're using this a lot on the humane treatment of animals for equine and food animal medicine. And so this is what it looks like. Let me see if this will play. It should. Can you let me know if it's playing on your end? It's not even, there you go. Okay, and I'm just talking over it. So doing a physical exam. This also comes, by the way, with a Holter monitor. So you can send these dogs home with them. The owners can do them. Not maybe all animals, but this can certainly give you an idea. But see how cool that is. And so, you know, owners can look at that and have an idea. They can do it. You can do it through your telemedicine consults. And what I love about this is I'm going to be using this word quite a bit, the S word. This is a service item. A service item. And, you know, we're very good about sometimes complaining about third parties trying to chisel away at our bottom dollar. This is very good medicine, my friends. And maybe this is something that you can envelope in with prices going up, either in the cost of a physical exam, an extended consultation. But this is a service item. They can't really do this online. They need your expertise to do this. So I think that's something to really take into consideration. Another modality, and you could say yes or no in the chat or Q&A box or whatever, is if you're doing anything with thermal imaging. Digitherm comes to top of mind. There's other modalities that are out there, but this is another thing where they can actually do a scanner. I mean, so many of us have been temperature scanned and checked over the past several years, and so we know what we're looking for now that we know about thermography, and this uses the patient's body surface temperatures. So it converts those temperatures into images that help evaluate physiology. So again, technician can do a quick little glance, or you could do it with the pet parents. I'm so into empowering the pet parent. You know, again, they're the ones that have wallets and purses at the end of the day. So if they need to visually see the value of that physical exam, this is something that's really great tool. So they can look for pain, redness, inflammation, you know, whether it be the gums, the hips, you know, the front legs, those lick granulomas, like the list goes on of some things that you can look for that could be indicative of pain. So this does integrate well with quite a few PIMs, which is nice. And it's a great tool for both acute and chronic pain. So if you're looking at changing up your multimodal therapies for pain management, and you need to kind of make an assessment, you look together with the changes of the blue and the red, and the companies are very good at educating you further on it. But Digitherm would be the one that I would recommend out of the other ones that are out there for thermal imaging. Okay, I want to pivot and I want to talk about pain scoring here. I'm going to see if I can just blow this up a little bit without ruining this, because I'm really passionate about this pain score here. Hopefully you can see that now. That looks much better for you, so you're not like squinting should you want to take screenshots or whatever. Okay, so I love, hopefully most of you know that the CSU acute pain score. I love this for the following reasons, my friends. Again, we just started earlier talking about that disconnect that can happen between the pet parent and the veterinary professional. So this is a great social media play. If you have not put this on your hospital's website or Instagram or whatever platform you're using, you need to, because it opens up a conversation. You know, especially September is, you know, Pain Awareness Month by the AVMA, but it doesn't have to be in September, it can be anytime. But you can say, comment down below, if you think your dog is in pain, what number are they? You know, they may be wrong, but you know what it's doing? It's creating a conversation. Schedule your call today so we can assess your dog's pain score, your cat's pain score. I'm going to show you in a moment. I love this. I also have these in the exam rooms. I think it's a good conversation for even kids to learn about pain recognition. And so again, I use this. Hopefully you're all doing the body condition score. And I just wanted to take a brief moment back and share something with you, because it's something that really resonated with me at our Fetch San Diego conference last weekend. Dr. Mariana Pardo was our keynote speaker. She's a criticalist. And she said something that really, really was like powerful. And she said, she had a quote about the stethoscope. And she said, you know, back in the day when the stethoscope came to fruition, many said that no one's going to use this because this is just an unnecessary tool that's going to slow them down. Well, what would we do without the stethoscope? And her talk was geared towards ultrasound. And she said that her prediction is that, you know, using an ultrasound like a butterfly equipment, so those kinds of things is the new normal. She said, stop referring all ultrasounds to me. We all should be able to look for like effusions and the basic things. And so we also were talking about this talk that I was giving at San Diego. And we said, you know, we talk about body condition score. We're kind of there with body condition score. Pain score is where we should be at now in 2023. It's be part of your SOAP record, you know, even for their wellness exam, because it shows value to that physical exam. It shows value. And also it really does educate the pet owner at the same time. No one wants their animals to be in pain. Okay, I love the Feline Grimace scale. Hopefully you've heard of this one before. I'm certainly not the expert on the origin of the Feline Grimace scale, but I can tell you just as a general practitioner, and I teach this to my veterinary assistant students, I think this is a great, valuable tool. Do this at a lunch and learn. Do this at a team building exercise. Grab some pictures and videos of cats, some of your hospitalized patients that you see. Think of your PU cats. Think of your blocked cats. Think of the ones that have like horrible cystitis or uveitis in the eyes, just like those ones. And then some that are like recovering from a spay. Some are there for like a neuter and they're just like, hey, what's going on? I'm here for my testicle festival, because it really helps understand ear position, whisker position, and muzzles, I think, and eyes. So all those things really come into play. And this is just a 0, 1, 2, super easy peasy. But who would have thunk? If you told me 5 years ago, like, because I didn't know that this was out there until like I was all on board about this. I'm like, oh, I like this because, you know, we talk about silencia, we talk about ways to manage these cats with our OA, or, you know, cats that are just in pain that need to have like some shockwave therapy thrown at them. You just don't know. And so I share this, and I have this also put up in the treatment area because it's so good for your team to get that buy-in. Because what happens if they're just taking out the trash? You're busy. You're doing a whole bunch of things too. They're cleaning up the kennels and they see a cat that looks like a 2. Dr. Christman, I think you should take a look at this cat. I remember the Grimace score. It looks like a 2 to me. I might be wrong. Thank you so much for bringing it to my attention, because you're right. We got to figure out what's going on. This cat is really painful. Let's get this addressed. So really great things. Again, virtual care, great social media play. Ask your cat parents out there. Hopefully they're not, you know, 2s, but have a really good conversation about it. Another one that's out there is like the one that's for feline muscle condition scoring that measures sarcopenia and cachexia. You ever have a cat that's like your geriatric cat, normal CBC, normal T4, normal chem, x-rays are great, and you're like, you know, what the heck? And so some of them could have like normal like muscle wasting that they can have in people, but you can also look at muscle loss, moderate muscle loss. It gives you an idea, because some of that can be bearing on their hips and joints, of course, as they get older. So, you know, again, this is another thing. I don't use this, but I just want you to be made aware of it. That's courtesy of Tufts University. This one I do love. If you want to get a screenshot of this or write this down, please, please, please do, because I know you're all busy, my friends. I get it. We are. But pet owners love a good survey. They love to be empowered and bonded to your clients. You know, when I give my practice management talks, they say 20% of your clients are going to make up for 80% of your revenue. So not everyone may answer your surveys, but your cheerleaders to your practice that really are invested, really care. You know, the new study that came out from 2022 is that almost 25% of your clients have some sort of social media on their dog or cat. That is huge. You're talking about 1 in 4. That's how powerful social media and the bond, the human animal bond is. So you're going to give them a survey. They're most likely going to take this survey. And so the University of Pennsylvania put together this list of questions. It's already done for you, basically. So you can basically take them yourself. You just sign up for the account or whatever, completely free to do. And it asks some of these questions, like, for example, how severe is your dog's stiffness after the first awakening in the morning? Like, that's very specific, kind of granular information. And this is over the past 7 days. Again, you could tweak this any way you want. Later in the day, how severe is your dog's stiffness after lying down for at least 15 minutes? You can ask other questions like dogs that have been on like maybe a non-steroidal anti-inflammatory, multimodal approach if they're using like some sort of like a loops and things I'm going to talk about. But again, this begs the question of like how much pain, if any, are they in? And then you can go even further to talk about quality of life. And those can be, now I know Colorado State University and University of Purdue have great questions about quality of life, but these are some good ones too that if it has to get into that conversation, you can go ahead and do that. So again, I think surveys are good. You can attach them. You can send them out to your database. If you can actually tag if any dog over the age of 4 years of age, or, you know, if it's a large breed dog greater than 2, send this out to my clients, you know, and they can send them back in, or they can easily just do it while they're waiting to see you. Our good colleague, I know somebody is on the call here from across the pond. So got to give a huge shout out to our colleague, Dr. Hannah Capon. She's doing a lot of great work on canine arthritis management out in the UK. Go to this website when we're done. It's got a lot of great modules that are there that you can learn about canine arthritis, or you're listening to your dog, understanding pain management. So really cool stuff that's there. So I'd like to just kind of keep that on the radar. I also did write a book, as you heard in my bio, and I stress this because the reason why I'm a doxaholic is because I had a paralyzed dachshund for 12 years. That was a patient of mine, and his name was Cosmo. And Cosmo came to me at the age of 2, long-haired dachshund, and his owners waited 4 days to bring him in because they thought it was going to get better. Obviously, he was down in the back end. And I said to his owners, let me start by taking an x-ray. I had to start I don't have a CT machine, you know, I don't have a neurologist in my back pocket. So I had to like start somewhere to figure out, make sure nothing else was going on. So I come back in to the exam room and Cosmo's owners left. They never came back for him. And so Cosmo became Cosmo Christman. I took him. And so, but he did have a hemilaminectomy, but it was too late for him. So he had no deep pain. But I share that story with you, my friends, because, you know, you and I know that dogs can live an incredible life when they have either a tetraparetic or hemiparesis. So I think, you know, this book helps kind of take away some of that stigma. It's on Amazon, by the way, and I co-wrote it with Kristen Leidig-Bryant. She's great. She's down in Atlanta, Georgia. Does great work on dachshund rescue. But things like how to squeeze a urinary bladder. That's why it's called Heavy Squeeze a Dachshund for urinary bladder. A lot of information about that, because you and I don't have time for 20, even 30 minutes to talk about these things, and so it can be scary. So I'm really proud that this book has really moved mountains for many dogs. It actually was in Amazon's top 20 pet owner guides for last year. So so I always dedicate this to Cosmo. So that's for you, my handsome buddy. I love you. What do you get if you cross an elephant with a rhinoceros? Oh, if I know. You got to have a little humor. You got to have a little humor while we're learning here. I'm all about laughing and learning. And so this is why I need my audience to be like, oh my God, he's so funny. But okay, let's move on. Let's talk about integrated pain management modalities, okay? Because there's a boatload of them that are out there. And, you know, again, in this day and age, there's so many great things that are there. So let's chat about it. So my question to you, if you don't mind, if you could put them in the chat, I prefer a multimodal approach to pain management. Give me the number 1 if you agree with me on this, or give me the number 2 if you disagree with me, and then let's see what we can do. Very good, but thank you so much, Jane. I suggest my clients buy. Thank you so much. Yes, not doing thermal. I'm just getting to these questions because my windows are all closed here. Are you seeing these spikes in real time as you're examining them walking? Yes, Aaron, I am. Yeah. Let's see. Okay, see some ones coming in. Thank you, Dr. Cook. Thank you, Michelle, Aaron, and Jane. So yeah, so there is definitely like a multimodal approach, want and need. So comment in the chat box if you don't mind, again, my friends, what are some modalities that you recommend for both acute and chronic pain in dogs and cats? We know that there's a boatload of them, so I'd be really curious to see what works for you. What are your clients asking? You know, what do you have within arm's reach? Are there certain things that you refer out for? Because, you know, we work a lot with integrated practitioners. We work a lot with rehabilitation specialists. So there's a lot of things that are out there that I'm sure that you're using. And I do find in my experience now that pet parents are asking more about these modalities than I hate to say the word drug in a negative word, but sometimes, because they sometimes either want a magic pill, which doesn't really work. So I think a multimodal approach tends to work. So I see Dr. Cook says oral gabapentin and acetaminophen with codeine. Erin says laser therapy, Assisi Loop, and acupuncture. Excellent. Jacqueline saying medication, environmental management, laser, transdermal fentanyl. I see. Thank you, Dr. Cook. Michelle saying weight management. Thank you for mentioning that one. That one tends to get lost. Low impact, consistent exercise, joint supplements, NSAIDs, massage, range of motion exercises. Jane saying laser, acupuncture, hydrotherapy. Excellent. Thank you, everyone, for submitting those in. And so let's talk about some of these that you've just mentioned. The Assisi Loop. I'm a big fan of the Assisi Loop, and not because I'm dachshund skewed, because I do find great results with this. And, I feel like if you own a long back dog, you should just start getting an Assisi Loop. But it does work for decreasing pain and inflammation. A lot of great research and data is out there from Zomedica that has the Assisi Loop now, and accelerates healing in soft tissue bone. Dr. Tim Crow got me started on this. I don't know if you know him, but he's double board, an incredible human being. I'm going to mention his name one more time in a moment. But he taught me a lot about the Assisi Loop, and I started implementing it on my patients. And I'll tell you this too, my friends, is that your clients really want to be proactive. Let's face it, they truly are in the driver's seat. We're in the passenger seat, and the car is the hospital team coming together to help drive results for the greater good of those animals. And so they want to do something. They really want to be proactive about it. Why not give them something that really does work at home that you can integrate with so many other things? So it works well with other therapeutics. And, it uses, there's actually lots of webinars that are out there too on Team10 Technology that's been around for many years on the human side, the targeted pulse electromagnetic field. So it delivers that microcurrent. So you don't feel it. It feels like a very small, very, very, very mild vibration that's tuned to trigger the animal's own natural anti-inflammatory process. So it, upregulates the nitric oxide and causes biotherapeutic effects on target tissue. Now, you don't have to have these dogs literally through the loop, but you can have it near it, like near some sort of like a lick granuloma, for instance, or the backs or hips or anything like that. They now have the Assisi dental loop that's being used too. And Dr. Heidi Lepre, she talks a lot about the Assisi dental loop, as well as Dr. Jan Bellows. And some of them recommend doing the loops before they do maybe like the full mouth extractions on the cats for, the stomatitis issues. But then also post-operatively too, reduces the needs for maybe some opioids and other pain medication, helps in preparing for oral tissues for surgery. So, another thing just to consider that's out there. So Matilda Tate, you say they rehab the loop, Silencia, oral gabs. Excellent. I love it. I was at the gym this morning, you guys. This really funny story. It just hit me when you said this. So I love him. He was a friend of mine, but I overheard him saying, it wasn't to me, but he's like, so I'm going to go ahead. My dog's limping really bad today. I'm going to go give him Advil and some Tylenol today. And I almost dropped the kettlebell when I heard that. I said, James. He goes, what? He's like, I said, that's for human. I said, you're going to like slowly or quickly kill your dog with those meds. I said, it's 2022. There's so many great. He's like, well, I have gabapentin, but that doesn't work. I said, last time I checked, I'm the DVM here. I said, you can go ahead and like give these meds. Let me work with you about some modalities. But again, it's just so interesting that like pet owners still don't know in this day and age about some of these different options and modalities that are out there. And then I sent them information about the Assisi Loop because I do think it would work on this dog's hock that we're just talking about. So lots of great things. Before I go to bed with my dachshunds at night, we loop them because I have 4 weans. And 75% of my herd has intervertebral disc disease, so they get. It looks like this dog in the picture. They get looped, and T12, T13 tends to be the way where it is. And but I do think the post-operatively, by the way, they're fine. They're ambulatory, but I like to keep things at bay. And so this is something to consider for them. And it's available online. You can also have some of these like in your hospital if you wanted to send them home with them. Pet parents have been gotten very creative with how they go about using it too. I know I speak with the neurologist, Dr. Fred Winninger, talk about some brain lesions. He's seen some uses for it in that regard. Oral hematomas. The list goes on for that. So I think it's got some good use, and I see some of you are using it, which is great. So think of orthopedic degenerative diseases, wounds. I know everybody has one of these in the backyard, right? Everyone's got one of these, a hyperbaric oxygen therapy. But the point of this conversation tonight, my friends, is to show you the options that are out there. Because again, I have gone live on TikTok every night for 3 years. I'll say that one more time because it's like I still can't believe I'm actually doing that. I go live on TikTok every night. I've been sick. I've been on vacation, on holidays. You'll see me. But what I do is I get somewhere between 5,000 to 7,000 pet owners that come through the room, and I share this slide with you because several ask about hyperbaric oxygen therapy because they either use it for themselves, they heard of it, they're either near a veterinary teaching hospital. For example, the two that I was thinking of are from the University of Florida. And so, they use this often for like snake bite wounds or OA, and these dogs tend to sit quite darn well with it, believe it or not. So I don't know if any of you have any experience with hyperbaric oxygen therapy, but Dr. Tim Crow, another one who has taught me a lot about this, they talk about it. So again, there was just a celebrity tonight that was just talking about it. Jay Leno, who had the burns. The celebrity Jay Leno, he goes for hyperbaric oxygen therapy, and he swears that that's what's helping him with his wound therapy. Okay, I'm curious to see this one. Can you give me the number 1 or the number 2? Give me the number 1 if you heard of Sonovatin. Give me the number 2 if you've not heard of it. And I'll talk about using it. I just want to know if you've heard of it. Give me the number 1 in the chat if you could, if you heard of Sonovatin. Number 2 if you haven't, because this gives me an idea of where we're at with it. Because I do think that this is one for the books. This is going to be, how you heard Rimadyl come out and you're like, oh my gosh, back in the day, we have a non-steroidal anti-inflammatory. I do think this is going to be one of those game changers that's going to be vet med people are going to be talking about. So, yeah. Okay. So take a picture of this if you haven't. I want you to visit the website when we're done, learn about this. I'm not expecting you all to give intra-articular injections, into your patients with elbow disease. But I do expect you to be aware of it in case your clients are asking about this. And I do think of Dr. Matt Brunke down in Virginia, who's probably who has treated well over 105 dogs with Sonovatin. And this is an injection that goes in the elbow. It's technetium. It's a radioactive isotope, literally in the elbow. Intra-articular injection. It's good for 1 year. No other concurrent non-steroidal anti-inflammatories, other medications are needed for it. And I can say off-label that it is being used for other things, hips, knees. You know the deal with it for dogs. Okay, for dogs. I know they're doing some work in cats. I'm going to show you a story that's being used on another species, but this is something to think about. We know that elbow disease, OA, is a synovial disease, and this one, it depletes the inflammatory macrophages. I'm not going to get into too much details about the mechanism of action of it, but it does break that cycle, alleviating pain, inflammation, and the synovium is restored. I know that these dogs cannot be in the bed for 2 weeks because of the very, very low doses of radiation for it, but that's the only downside that I would say to it. Now, I've talked to Matt about this with his dogs, and I think I'm going to show you a video of like before and after videos. It's pretty impressive of these dogs. So, but yeah, something again, just to be familiar with. Typical price for this, just so you have an idea, US dollars, you're looking around $3,000 per elbow. Okay, so that's from like sedation and doctor time, half day hospital kind of a thing. Just gives you an idea. So, why is she referring them? I think elbows do suck because they can be tough if you have like, is it an ununited anconial process? Is it osteochondrosis dissecans? Is it elbow dysplasia, elbow disease, elbow arthritis? But, it's a good thing to help refer them. Clients will feel empowered. I will tell you, this is trending a lot on TikTok with pet owners are hearing about it. So they just did this one with this Komodo dragon at the Smithsonian National Zoo. How cool is that, huh? 26-year-old lizard. And they showed that he had arthritis, and to this day, it has changed this beautiful guy's life with Sonovatin. So just pretty impressive. Let me just show you. Yeah, let me show. Hopefully, this plays the before and afters of these dogs, so you have an idea. You're about to see some incredible before and after videos of patients that have received Sonovatin. This is a once-a-year injection that goes in the elbow for the treatment of osteoarthritis in dogs. Pretty impressive, right? Learn more at Active Dog I do love that video. And I do like that one of the attendees on the call now just talked about weight management, because if you look at that golden retriever, for instance, it's one thing to have the injections, another thing to also get some of that weight off of them, right? Okay, moving on to shockwave therapy. Give me the number 5 if you've heard of shockwave therapy, but then also I want you to drop the number 7 if you use shockwave therapy. So give me the number 5 if you heard of shockwave therapy, and give me the number 7 if you are using shockwave therapy, because this also just helps us understand, like, that you know that it's around. Sometimes you hear that, like, oh, this seems so foreign to me. I know laser therapy, but not so much about shockwave therapy. So let me know. Okay, so I see Matilda has some use with it. So excellent, cool. Thank you for sharing, everybody. Thank you, Nicole. Thank you, Jane. I see you, Aaron. So, what I love, we'll talk about the shockwave therapy. So it's a therapy for dogs that have shown positive results. So we think about like your typical inflammation, OA, some wounds, not wounds, take it back, some like post-operative care. And so hip, elbow dysplasias, those kind of situations as well. And it's quick. I'll say that one more time. It's quick. And it's not related to any electric shock when you think about it. But a shock wave is a noise. It is a shock wave. It's going to be kind of a louder noise. And the animals really do respond well to it. And they get, I will say, I see dogs rarely flinch from it, especially cats. They're like, whatever, But, shockwave is a high energy sound impulse from supersonic craft, explosions, lightning, for example, just to kind of give you a concept of what we're talking about here. And so, you think of these high energy sound waves that penetrate deep into the effective stimulating cells, release healing growth factors. So again, it's using its body's own way of healing to get better. And I think the new probe that the Trove that PulseVet has helps minimize and streamline that even better too. So that way you don't have to, it's like only 3 minutes per session that you have to do because of the way that probe is, which is awesome. So, we know that the physical shock wave causes that immediate biological response to physical stimulus. And what happens? We know bone morphogenic protein, for instance, that's happened. That's familiar with bone regeneration. We know the release of those angiogenic factors, and that helps increase that functional density of capillaries, I should say. And then also the release of those cytokines. So, it has like this nice, cascade effect. And there's a lot of great studies that are showing the use of shockwave therapy. And again, it shows other things of the role of angiogenic growth factors in healing, tissue healing, osteogenesis, endothelial cell proliferation. The list goes on in that regard. So it doesn't require any sedation too, my friends. And I know you're busy. You're so busy in those rooms and whatnot. And again, tech time is equally valuable to you. So you're looking at maybe 3 to 5 minutes for the session and less time. They don't have to come in as often. You're looking at 1 to 3 treatments that you see at the bottom of the screen there. So again, you can envelope this into the S word that we just talked about, service item. This is a service item. You can bring this in for house calls too. You can move around. You don't need to wear your PPE for this. So just some things and logistics to think about. And if you're not using it, please consult with the folks that over here with Zomedica over here on the PulseVet one, because I was just looking at this one because I like this image because I want to show you. It's not that big. So you can like literally carry this from exam room to exam room, or like I said, with house calls, for instance, you do this in the car. A lot of great indications for doing that. But I do like that a lot. Just don't drop the probe. Like there's always somebody, like, don't be that person to drop the probe. You know how that goes. So don't be that person. But we like to look at some studies. So this is another great paper. And this is like, look at the date on this. This is a 2018 extracorporeal shockwave therapy, improving short-term limb use after TPLO. So we're seeing some great research that's done there. Also for shoulder lameness in dogs from Becker et al. On this paper. And there's another one on high energy focused in shockwave therapeutic, accelerating bone healing. So, really good stuff that's happening in that regard. So they did another study here with chronic pain. This is a retroactive study of 38 dogs and 2 cats. Yay, we got 2 cats with cauda equina syndrome with 1 to 2 shockwave treatments. And look at this, my friends, 87.5%, almost 88% of them with cauda equina syndrome had a positive outcome after shockwave treatment, singular. 77% of patients showed improvement within 1 week of treatment. 80% of patients had sustained improvement at long-term follow-up. That's pretty impressive, right? And, you know, the price of it, you can chat with your Zomedica reps about it, but I know we all have different budgets for it, but I can tell you that, you know, this will be worth the investment. It really will. And you're doing good medicine, really good medicine. This is our good friend, everybody, Dr. Jen Bertucci. She's wonderful. If you haven't seen her, please catch her on my talk show too, DVM 360 Live. We go over the PulseVet image thing. I'm going to show you a video of it, but you can learn more about it. I tend to really lean on her expertise, and she's so good. And she literally will give you the shirt off her back. She's such a great person to reach out to for anything and any questions you have. So please, please, please reach out to her if you need anything. But she's taught me a lot about this, about moving the trode around the angle and 3 to 4 minutes per area with electrohydraulic shockwave. There's no risk of burning. It's a big question that I get from pet owners, and like some of the lasers that you can have that issue with. I like this. This is kind of like the holy grail. So I kind of know like where I'm going and like what are the pulses that I'm using, 850 to 1,000 pulses on the elbow. I'm looking at the hock, carpus, those kinds of things. So so that's pretty cool that they send you that. And then here's some video. Let me see if this will play. There's Dr. Bertucci. Look on a cat. And she's using the gel a little bit to increase contact time a little bit on that. I know some asked questions about that. So that's what that looks like. This is another video, the same thing, but this is just on a dog's hock. But, you know, again, the dog's not sedated. No one's wearing PPE. And dog's doing fine. That's on a hock. And then also on this one as well. So, yeah, so some other indications for chronic back pain, relief of muscle pain due to like the spondylosis deformans, chronic intervertebral disc disease, lumbosacral instability, osteochondrosis lesions, sesamoiditis, tendon ligament injuries, tendonitis, fractures, those lick granulomas, and then CCLs. So there are a lot of great indications for it. Give me the number 5. Are any of you recommending or doing acupuncture? Give me the number 5 if you are recommending it too. You don't need to sedate the dogs, Jane, at all. Maybe some dogs, if they have general anxiety to begin with, maybe give them a little GABA before they come over for their appointment. Maybe trazodone too, you could do so, but yeah, not often, you know. Patient selection is always important to chat about. Acupuncture, I love. This is another thing, you know, after the back dogs have their hemis, I do recommend some acupuncture. I swear they get the zoomies afterwards. But there's one patient of mine, I don't do acupuncture, but my friend, Dr. Chris Shapley, he's an acupuncturist, but he's been treating a dog for IBD or IBS just with acupuncture. So it's just interesting how some dogs respond differently to different modalities. But I think acupuncture is incredible, you know, really great modality. Again, you can add this into other ones that are out there. A lot of pet parents are asking about it. They either go for acupuncture themselves. By the way, I got to tell you really quick about this clinic in Chicago, Illinois. I'm full of all these great connections and people. So if you ever need and want to learn anything, oh my gosh, there's a clinic in Chicago. These 2 wonderful young entrepreneur veterinarians, they open up a practice together. I just love innovation. So very upscale kind of a vet hospital, integrated modalities. One of them is an acupuncturist too. So they have this. Then they also have like a wine bar for the pet parents and everything. They have like a wine night in the evenings. Like it's really, really cool. There's so many different practices that are different, like have different things that are there. There's a vet practice in LA, Los Angeles, that caters specifically to the pet influencers. So like their waiting room is like a red carpet, and they have like the step and repeat of their hospital's logo. They have the ring lights everywhere, flash photographer. I mean, these are like dogs and cats that kind of know they got it, you know? They're catering to those kinds of dogs. But I share that with you because they know all these different modalities that are out there. And so if you don't know it, then they might go to a practice that does have it. So in closing here, just to summarize, we covered a lot this evening and a lot of newer tools to assist in identifying pain in our patients. I'm not telling you that you need to use all of them. I'm just telling you that you should at least be educated on them so that you can also make great decisions for your practice, your team, if you're looking to either change a modality up or if you have pet parents that are asking you these kinds of questions. I think it's great. And incredibly innovative modalities that are now available for pain management. So use them. So, if not you, have a friend that can maybe refer a patient on over to you, or likewise. I think that's the beauty of veterinary medicine. I know with COVID that was here, we felt more connected, as distant as it could be, if that makes sense. I had the privilege and honor of chatting with so many veterinarians around the world during quarantine, and just really getting to know about what they use for like pain management and modalities. And I will say that the integrative approach is probably the number one thing that we all have as a common denominator around the world. So whether it be like acupuncture, homeopathy, herbal remedies, laser therapy, Assisi loops, these are really hot items that are being used around the world. So I think that's really awesome. So that goes to my third point is pain protocols with traditional and Eastern medicine are available. Use them. Some of you are very adamant about not using one versus the other, and that's okay. But I do think that a lot of pet owners are asking more about different options that are out there. And I know we are evidence-based profession. So, and I stress that a lot with the pet owners, because there's a lot of noise that's out there, a lot of noise. And I have a lot of companies that will reach out to me for me to do like a TikTok video for them. And I have said, I probably can count this year in 2022, I probably said no at least to 100 companies that wanted me to do something that was not evidence-based. You know what I mean? And so I know that I have a platform. By the way, I'm approaching 1 million followers on TikTok, which is great. But I know that people come to me to lean on my expertise to be a representative of our wonderful profession. And I don't want to steer them wrong with something that doesn't make sense. And the same thing goes for you. What we talked about this evening has a lot of great studies and data that's there. And I think that's good to support. And I do got to give a shout out to Zomedica. They really do move the needle. Even with the Truforma, if you're not using the Truforma, I think it's a great one for T4. Great research and data. Dr. Deb Greco, you probably know her. She's the endocrinologist guru. A really great machine that I love. And, I'm just getting on my soapbox about all the great stuff that's out there. I just don't want us to be stuck. I think it's easy for us to complain, and it's harder for us to be comfortable being uncomfortable. And so I want us to start being uncomfortable and get used to some of these changes. I mean, my gosh, it's so hard to change our heartworm prevention, let alone to do some of these modalities. So pet owners, like we just said, want to use them. So try to use them. And the ability to offer clinically proven safe, sedation-free treatments for many difficult cases can truly be a key differentiator for many of your practices. So I think that's really cool. And brag about it on social media. We now have Shockwave Therapy. And ask us more about it. Have an open house about it. Do a Zoom call with the community about Shockwave Therapy. Poll the audience on what their thoughts are, your community. We're thinking about having this modality in. What are your thoughts? Should we or shouldn't we? You get their buy-in. I really do think it's important. So that's it for me. This is my magazine, not mine. I work for this magazine for DVM 360. Hopefully you're getting the magazine. It's a lot of fun. It's got a lot of great content that's in there. So please, 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 subscribe to that.